Fellow Cameroonians, our country has joined the global community in the fight against coronavirus disease, also known as Covid-19. This is going to be one of the toughest challenges our country has faced. Unlike many parts of the world, we are in conflict in a significant part of our national territory. In these regions where people are already dying and where access to healthcare is extremely challenging, coronavirus disease will be an enormous risk and an additional burden. We have a weak healthcare system that is completely unprepared for a crisis of this scale. We have a weak economy that is dependent on commodities and that is largely informal. 90% of our workers work in this informal economy. The measures required to fight this virus are extremely difficult for these workers to bear. The above are not reasons to despair. They are reasons for us to realize as a nation the magnitude of the effort we must put forth to keep ourselves, our families, our communities, and our beloved country safe. I would like to start off by saying coronavirus is real and it is present in our country. This is not a foreign disease. Wherever it came from, it is now here amongst us, and we must protect ourselves. While cases have only officially been detected in Yaoundé, it is more than likely that the virus is already present in other parts of Cameroon. Please take precautions everywhere. Thirdly, you may be carrying coronavirus disease without experiencing the symptoms. It is therefore important to follow the safety instructions, even if you feel healthy and well. Whether we like the government or not, it is the authority responsible for our healthcare in this crisis. Do not listen to your neighbor, your best friend, or the kind stranger who has just sent you a WhatsApp message. There are many things the government has already done wrong in managing the crisis, and there will be time for blame and profound criticism. But this will only happen if we survive. This is a pandemic. It is serious. Go to official sources for information. We may challenge them, we may question them, we may demand answers from them, as is our right. But in this moment, start with the government's information. Other reliable sources, such as the World Health Organization, the African Center for Disease Control, and renowned international research centers can help us control and verify what our government is telling us. The symptoms for coronavirus disease are fever, dry cough, headache, shortness of breath, runny nose, amongst others. If you feel these symptoms, do not go to a hospital or clinic. Do not go to a hospital or clinic. Call the emergency numbers and medical professionals will come to you. The emergency number is 1510. 1510. There are a number of other numbers that will be put on the screen here for you to be able to call. Please do not go to a hospital or clinic call the emergency numbers if you feel the symptoms of the virus. The most important thing for Cameroonians is that we avoid getting sick and that we prevent the virus from spreading. We need healthy Cameroonians to achieve our political transition. We need healthy Cameroonians to build our country after this regime is gone. We ask you, therefore, to please respect the following scrupulously. 1. Wash your hands with soap and water regularly. The most common way this virus is spread is from hand to hand. Use soap and wash the front and back of your hands, as well as between your fingers and under your nails. Count to at least 40 as you wash to make sure that you are washing your hands for 40 to 60 seconds. Secondly, avoid as much as you possibly can direct contact with others. There is no way of knowing who has been exposed to coronavirus, and you may be a carrier yourself. So please, do not shake hands or embrace others in greeting. Maintain at all times a distance of about 2 meters between yourself and others. Government has closed all schools. Please keep your children at home. However, they must stay in the home and they cannot go out to play with other children and with neighbors. Please avoid large crowds and groups. This means we should avoid bars, markets, and we should postpone our celebrations and events. Any situation with over 5 people should be avoided wherever possible. To avoid markets, please try to buy food and stock for as long as your finances can permit. We know this is difficult. We are all struggling financially. However, if you can stock for 2 weeks, 1 week, or 3 days, please do your best. Stock for as long as you can to avoid going to the market often. If you have the possibility of working from home, please do so. There are no easy solutions for people whose jobs demand contact with the public. If you are going to be in a crowded space, such as a taxi or the market, please try to use a face mask. If you need to cough or to sneeze, please do so inside your elbow. This will avoid you from spreading the disease and will also limit you from spreading it to others through your hands. Though they were late in initiating action, the government has taken 13 measures yesterday, including the closing of our borders. These measures are difficult, but necessary. It is good that government has finally initiated a plan, even though within the first hours of implementation, it is evident that insufficient work has been put into thinking through the resources and effort needed for execution. In addition to these measures, it is therefore important that the government carry out other important actions in the short, medium, and long term. In the short term, that is, within the next 3 to 10 days, government must put in place a daily press briefing. This is a channel to communicate directly with Cameroonians in order to provide up-to-date, reliable information as well as to answer questions. In moments such as this, the absence of official communication leaves a void that fake news, lies, and manipulation compete to occupy. Government should equally put in place a hotline, a Facebook page, and a Twitter account with the sole responsibility of answering the questions of Cameroonians. Government should take special measures for the most vulnerable populations in our country, such as the internally displaced, refugees, the elderly, and those living with disabilities, as well as the homeless. This should be done in the short term. These populations are at risk, and if care is not taken, they will be victims and vectors of the spread of the virus. Still, in the short term, government must increase its ability to quarantine. Quarantine is recommended as one of the best means of stopping the virus for all at-risk populations. Government attempts at this have been poor so far. Government must concert with all actors, public, private, confessional, etc., to increase our infrastructure capacity for quarantine and for isolation in the case of infection. Still, in the short term, government must inform us on the resources available and the possibility for large-scale testing. Large-scale testing has been successful in many countries for stopping the spread of COVID-19. While we realize that large-scale testing is resource-intensive, it is important that government analyzes this option, discusses it with us as citizens, and informs us on the choices made and the reasons for them. Government must make special provisions for health and all other frontline workers. This crisis will be most taxing on those who have to take care of the sick and those who are at risk. This means additional working hours and additional care and attention to patients. Government must provide the incentive for healthcare and other frontline workers in terms of training, protection, pay, job security, and job promotion, etc., that will enable these workers to make the sacrifices necessary for the safety of all. In the short term, government must concert with private sector, notably the informal sector, to analyze the economic impact of the pandemic as well as the government measures taken. Measures will only be effective if economic actors adhere to them. All measures taken will impact the economy and workers' health. It is necessary that government analyze with the key actors and put into place resources to accompany economic actors in both the formal and informal sectors at this moment. Finally, in the short term, government must concert with the electricity and telecommunications operators to ensure availability and access to services at reduced cost. Social distancing is recommended as a measure to stop the spread of COVID-19. People must work remotely and continue to produce for the economy, even as they self-isolate. To do so, access to electricity, telephone, and the internet must be available. Given the dismal performance of these services prior to the crisis, it is essential that government sit down with these operators and find solutions for the short, medium, and long term. These are recommendations for the short term. In the medium term, 11 to 30 days, we recommend this pandemic is an opportunity to end the conflict in the Northwest and Southwest regions. At the very least, it is an opportunity to negotiate a ceasefire. The threat on all lives, regardless of political opinion, is an opportunity to come together, negotiate, ceasefire, and begin to build a pathway to peace and justice. Government should use this opportunity fully to end the killing and violence in those regions of our country. Still in the medium term, government must adjust budget, economic forecasts, and economic decisions to this new reality. The tumbling of the price of oil on the world market, the impact on the CEMAC and larger African economies, the effect on the economy of our biggest trading partner, China, as well as on the European and American economies, will greatly affect our own economic well-being in Cameroon. Government must carry out this detailed analysis and take proactive decisions. Government should also negotiate new partnerships for healthcare. Numerous countries, organizations, and even individuals have come forward to offer assistance to fight COVID-19. The government of Cameroon must examine these opportunities, not only to obtain assistance in the very short term, but also to rethink our partnerships for healthcare in the future. Those are the recommendations for the medium term. Finally, in the long term, 30 days and more, this crisis has demonstrated the extreme weakness of our governance. From healthcare to infrastructure, national security, to the administration of our national territory, we have seen a lack of proactive planning, delivery, and decision-making that has resulted in the lack of water to enable citizens to wash their hands and remain safe and stop the spread of the virus. The extreme limitations of our healthcare system in terms of infrastructure, personnel, and budget. The very low access to electricity and internet services when people need to be working remotely. Lack of planning, decision-making, and proactivity has also led to an infection rate that evidently could have been much lower, or even avoided altogether if proper precautions had been taken. We have also seen in this crisis a total lack of confidence and trust in government, which has led to the endangering of the lives of citizens. This crisis has once again demonstrated the absolute need for political transition in our country, to establish a system of government that is truly at the service of citizens. It was true before the crisis. It is even more true after the crisis. The Biya regime must end. During this crisis, the Cameroon People's Party will make all of its resources available and will work with every actor, including the Biya regime, to stop the spread of the virus and limit its effects on the health of Cameroonians and on the health of our nation. The pandemic, however, reinforces our conviction at the Cameroon People's Party that a political transition is a matter of survival for our country. Let us work together to stay healthy. Let us work together to limit the damage of the pandemic on our country. and let us work together to build the strength to achieve political transition, because we need it. Blessed be Cameroonians. Long live